morning, and welcome to the 4th Annual Global Summit on Kidney Innovations. My name is Dr. Barbara Bass, and I have the distinct honor of serving as the Vice President for Health Affairs at the George Washington University, Dean of the School of Medicine and Health Sciences, and CEO of the GW Medical Faculty Associates located here in Washington, D.C., the capital of the United States. For those of you around the world joining the Global Summit for the very first time, welcome. We are so glad to have you join us for this unique forum hosted by the GW School of Medicine and Health Sciences. This year, we are very pleased to partner again with our friends from the American Association of Kidney Patients. As partners together for these last 4 years, we have conducted this important and very timely multi-stakeholder international educational event. The AAKP is the largest kidney patient organization in the United States. A leading voice in American healthcare policy and advocacy, AAKP has elevated the independent perspectives of kidney patients to White House and congressional leaders for more than 50 years. By organizing patients to advocate collaboratively with scientists and medical professionals, AAKP has brought greater funding to kidney research and to those working on innovations in kidney care. Over these past 4 years, the Global Summit has highlighted many of the exciting discoveries and innovations transforming kidney care in America and around the globe. And over the past 3 years, the Global Summit has brought you timely information on how COVID-19 has impacted kidney patients and kidney medicine. While there are many challenges that remain, this is a most promising era for kidney medicine, with patients and their insight data shaping many new discoveries. I welcome my partner and co-host, AAKP President Mr. Richard Knight, a 16-year kidney transplant recipient and former U.S. congressional staffer. I would also like to thank our returning Global Summit co-chairs, GW Professor of Medicine and Director of the Division of Renal Disease and Hypertension, Dr. Dominic Raj, a true champion of scientific discovery and innovation in kidney medicine. He is joined by co-chair of the summit, Mr. Paul Conway. Mr. Conway is chair of policy and global affairs and a 25-year kidney transplant recipient who has served under 3 U.S. presidents. The George Washington University School of Medicine and Health Sciences was founded in 1824. We will celebrate our bicentennial next year, making us one of the oldest medical schools in the United States. Since our founding, this school has been at the forefront of medical education and has grown to include highly ranked programs in health and biomedical sciences. We are well known for anticipating and incorporating the latest advances in medical treatments and care innovation into our curriculum and medical training. As a premier medical school, we are highly interested in the breakthroughs that are unfolding in the field of kidney medicine, including new drugs that slow the progression of kidney disease, new home dialysis technologies, and important advancements in the fields of artificial, implantable organs, and xenotransplantation. Today, under the leadership of our world-renowned faculty, GW students and residents enjoy innovative educational methods and curricula, and state-of-the-art training in our clinical sites. With dozens of top-tier residency programs, the GW School of Medicine and Health Sciences is a highly competitive and distinguished destination for medical school graduates from across the nation. I applaud Dr. Raj and Mr. Conway, who took the initiative in 2019 as a doctor and kidney patient team to put the inaugural Global Summit together, joining these 2 organizations. I believe this annual event confirms that the future of innovation and improved health outcomes are indeed being shaped by strong collaborations among patients, their doctors, researchers, and broad networks of professionals from academic medical institutions, the private sector, and government. Beyond the classroom and academic setting, GW faculty and graduates have always been known for the impact we have on our surrounding community in the provision of top quality care, and for putting patient concerns and insights at the center of care consideration. For our medical program, patient engagement and innovations are not new. They are the foundation upon which our program was built. Our alumni are at the forefront of modern medicine and serve across the globe, delivering care and saving lives every day. The Global Summit provides GW another opportunity to demonstrate that through technology and a worldwide network of medical educators and researchers, GW has expanded the definition of community. We serve that as one that is truly global. In fact, in 2021, our summit was live streamed in over 80 countries and viewed by an international audience in the tens of thousands in real time and follow-on programming, being on-demand sessions. This includes researchers, medical professionals, government officials, and patients. This year, our audience will hear from over 50 patient and medical experts. You will learn more about the research and innovation underway in research centers, clinical trials, and in major pharmaceutical companies. These include important advances in genetic research and kidney precision medicine, along with the latest news on advancements in artificial implantable and wearable kidneys. And you will also learn about updates in therapies related to life-saving organ transplants, telemedicine, and the next generation of diagnostics and biologics to help detect and slow progression of kidney diseases and kidney failure. GW is so proud to be a catalyst in this noble effort to unite patients and professionals together, to learn and to expand our efforts to save more lives through medical research and innovation. I am so pleased that you will have access to top experts and presentations, and I know this information will be helpful to medical professionals and patients around the world as we battle this deadly disease. Once again, thank you for joining our 4th Annual Global Summit on Kidney Innovations. Please consider GW a strong ally and expert resource in the battle to save lives and improve patient outcomes for those who suffer from kidney disease. I wish you all the best for a fabulous summit.
Hello, everyone. Thank you, Dean Bass, for the kind introduction. It is an honor for me as president of AAKP and a kidney patient to speak before old and new friends in the fight against kidney disease at our 4th Annual Global Summit on Kidney Innovations. Global Kidney Patient Voice, the key to accelerating innovation. AAKP is joined by our partners from the George Washington University School of Medicine and Health Sciences to host this series of exciting sessions about innovations that will demand a change in the status quo of kidney care and the vital role kidney patients play across the globe in advancing research and aligning regulations and policy to improve the lives of more than 850 million individuals worldwide suffering from some form of kidney disease. Last year's Global Summit engaged participants in over 80 countries, with over 15 special medical and patient expert sessions and more than 40 medical and patient subject matter experts. Over 20,000 viewers tune into our sessions, whether in real time or on demand post-event. And we know that this year's summit will have an even greater reach as AAKP Global expands and the AAKP initiated Decade of the Kidney accelerates into year 3. I'd like to recognize and thank my colleagues who are participating today: AAKP Board of Directors, AAKP National and International Ambassadors, esteemed colleagues from George Washington University, and the many speakers joining us from here in the United States and around the world. We appreciate you sharing your time and expertise with us. I'd also like to thank the hard work of our staff, led by our outstanding Executive Director, Diana Kleins, for continuing to expand our global reach by executing this event in partnership with George Washington University. I need to also acknowledge the co-chairs of the summit, Paul Conway and Dr. Raj. As I have said before, vision matters, and these two exceptional leaders have no lack of it. Their relationship and the marriage of these two organizations is an example of bringing a vision of patient engagement and innovation into reality. Simply put, folks, AAKP's mission is to educate and advocate, Today's Global Summit is an alliance focused on kidney disease education and the advancement of care choices and access for patients. For this year's summit, we will continue to focus on the impact of COVID-19 on kidneys and kidney patients, and including kidney patients in more clinical trials. Implicit in my reference to more patients in clinical trials, I include African Americans, Hispanics, and other peoples of color, as well as underserved communities. And I emphasize as a standard, not as an add-on, particularly in relation to COVID-19. We also focus on key innovations in kidney care and talk about barriers that kidney patients face and the steps we need to bridge these barriers. Well, what is our plan? We submit that an emerging global consortium for kidney innovations, patient consumers are rejecting the status quo in kidney care and related high mortality rate. Furthermore, patient consumers are united in removing impediments to innovations in kidney care and life-saving clinical trials. Everyone, that is what the decade of the kidney is all about. Patients at the table, engaged in discussion, and influencing decisions being made about them. We respect all professionals who have embraced the science of patient engagement. We speak to that science in a series of articles recently published in CJASN. Now, I'd like to take a brief moment to thank our sponsors. Novartis, a gold sponsor, Kimbo Biotech, a silver sponsor, Horizon Therapeutics and Travere Therapeutics, bronze sponsors, Mallinckrodt Pharmaceuticals, patron sponsor, and Teleris Therapeutics, supporting sponsor. As always, we appreciate their support of this fourth annual Global Summit. Now, folks, on a personal note, I share this with you. I first visited Washington, D.C. in 1963 when I attended Martin Luther King March on Washington. When I encountered folks in the tent city, I was shocked. I was shocked at our lack of humanity towards them. That was 59 years ago. I have engaged with patients from countries such as Malaysia, Mexico, Kenya, India, Lebanon, Hong Kong, and cities such as Baltimore and Washington, D.C., to name a few. And the word that still comes to my mind is humanity. My friends, as we innovate, as research brings us more and better patient choices, we must not forget to show humanity towards all of our patients, regardless of their station in life. Now, I would like to introduce the one and only Dr. Dominic Raj. He is the Global Summit co-chair and a director of Division of Renal Diseases and Hypertension at George Washington University. Let's welcome Dr. Raj and turn it over to him.
Thank you, Richard. Welcome to the 2022 Global Summit on Kidney Innovation, co-hosted by the American Association of Kidney Patients and the George Washington University School of Medicine. As Richard mentioned, I'm Dominic Raj, the co-chair of the summit, along with my colleague, Mr. Paul Conway, the chair of Policy and Global Affairs and the immediate past president of the AAKP. I'm the chief of the Division of Kidney Diseases and Hypertension at GW. I recall meeting with Mr. Paul Conway, Diana Kleins, and Richard Knight in 2018 to discuss the need and feasibility of a patient-centered kidney summit. The first summit was held at the GW Jack Morton Auditorium in 2019, which has since grown to become the largest international patient-led conference in the kidney space and a powerful platform for highlighting the innovations in nephrology and connecting the experts worldwide on issues related to patient care and patient access. Let me introduce you to the two summit partners. The American Association of Kidney Patients was started in 1969 by 6 dialysis patients at Kings County Hospital in Brookline, New York. It has grown into a nationally recognized patient organization that reaches to over 1 million people annually. AAKP is committed to improving quality of life for kidney patients through education, advocacy, and patient engagement. The GW School of Medicine was founded in 1824 as a medical department in Columbian College, now called the George Washington University. The GW Medical School is the first in the nation's capital and 11th in the country. The first life-saving dialysis was performed in GW Hospital in 1956, only 2 years after it was introduced in the US. In 1964, Professor Alvin Parrish opened the Washington's first non-military outpatient dialysis unit. Our commitment to care for patients with kidney disease continues unabated even today. Our first summit in 2019 was an in-person event with an option of participating virtually for international attendees. To our great surprise, the total number of participants reached over 10,000 individuals. Restricted by pandemic, we transitioned to a virtual mode in 2020. With 17,000 viewers, which increased even more to 20,000 for the 2021 meeting. As we reached across the globe, the number of participating countries increased from 50 to over 80. For the 2022 summit, we have leveraged the advances in technology with the introduction of virtual networking lounge, discussion board, and other fun things as we accelerate towards the innovation in kidney disease management. Chronic kidney disease affects more than 10% of the general population worldwide, amounting to about 800 million individuals. It has emerged as one of the leading causes of death. CKD is more prevalent in older individuals, women with racial minorities. Unfortunately, kidney disease represents a large burden in low and middle income countries, which are least equipped to deal with its consequences. The kidney community has lamented that clinical trials in nephrology is among the lowest for any subspecialty. Concomitantly, the Medicare spending for CKD and ESRD surpassed 120 billion in 2019, suggesting inadequate preventive measures or treatment choices. To our joy, we have witnessed a resurgence in drug development for kidney disease over the last 5 years, with a significant growth in drugs in pipeline and in clinical trials. The current momentum in nephrology is probably driven by the increasing societal and economic burden imposed by CKD, as well as scientific advances that have enabled discovery of new drug targets. The global nephrology drug market was valued at about 14,000 million in 2020 and is projected to reach 23,000 million by 2030. Several new initiatives from NIH, directions from Kidney Health Initiative, and accelerating innovative discoveries through KidneyX certainly have contributed to our success. Indeed, we have seen a stunning progress in developing innovative drugs, novel diagnostics, devices, and patient-centered care models for nephrology. You will hear about many of these top stories during the summit. Importantly, as a community, we boldly took a stance about the race. We believe that mankind is one and that all people belong to the same species, Homo sapiens. Realizing that race is not a good proxy for genetic differences, we eliminated race from calculation of kidney function. This is an important step demonstrating our commitment to providing more equitable care to all. Furthermore, major advances have been made in the treatment of diabetic kidney disease, and, and we are closer to xenotransplantation than ever before. COVID continues to have a significant impact on our lives. As a community, we reacted to the pandemic and proactively implemented policies specific for nephrology with significant positive impact on outcomes. In fact, AAKP conducted several educational seminars in which GW nephrology proudly participated. We continue to learn more about the long-term effect of seemingly mild COVID infection, but with deadly long-term consequences. Yet, neither did the pandemic stop us, nor did it impede the innovative progress in nephrology. But in fact, we accelerated the discoveries even faster. We know you could be elsewhere, but you chose to be with us in this important event, showing your commitment and support for the cause. The Summit Organizing Committee extends a warm welcome to everyone. You may not see or know many selfless warriors who have been working incessantly behind the scenes. The event is the result of their hard work. Now, sit back in your most comfortable chair and enjoy the event and be inspired. Do give us feedback, tell a friend, and share the invitation. Now, I invite my inspiration and co-chair of the Global Kidney Summit to chair the opening session that will inform us how the patient voices could be key to accelerating innovation in nephrology. By the way of formal introduction, Mr. Paul Conway is the Chair of Policy and Global Affairs and the immediate past president of the American Association of Kidney Patients. He is the recipient of the Silver Medal from the Department of Homeland Security for exceptional services. He has also received both the ASN and AAKP President's Medal for Policy Advocacy before Congress and White House. However, the badge of honor he boasts most about is that he has managed kidney disease for 42 years, including 3 years on peritoneal dialysis and for the past 25 years with a kidney transplant. Paul, now take it from here. I know you can do very well.
Thank you very much, Dr. Raj. You're a fantastic co-chair and a very good friend. 42 years with kidney disease. I tell you what, it's doctors like Dr. Raj that make an experience that I have with kidney disease easy. He's my doctor, he's my friend, and he's a leading medical research expert, and he has really been a champion for patients from the first day I met him, and he is the one that was my inspiration for launching the Global Summit on Kidney Diseases with George Washington University and the American Association of Kidney Patients. It's a fine partnership, and he is an absolute gem in terms of patient advocacy and being a friend to patients.